Not getting enough sleep as a child may increase the risk for obesity. That is one of the stories we're talking about in today's Health Watch. Dr. Krista Foster back with us from Baylor Medical System. Okay, so the study is from Project Viva. What does sleep, what's the connection here? Why does it play such an important role in our weight?
So sleep is so necessary in order for us to restore our energy and to regenerate our cells. And if we don't get enough sleep, our body wants to get energy from other sources. And it tends to be high-calorie foods, and it increases the hormone that tells us that we are hungry. So it increases our appetite.
Really? So the more you sleep, you tend to stay a little bit lower.
Yeah, you eat less, and yes, exactly.
Okay, we need to talk about MERS. This is really scary, and we understand it can be passed along even by a simple handshake. How so? Give us a little more insight on MERS.
So MERS, interestingly enough, MERS comes from the same family of viruses as a common cold. But unlike the common cold, almost 30% of people who come in contact with MERS are going to die from it because it causes severe respiratory failure. Now, before we used to think, it only was spread in close household contexts. But this new case had a person who just shook hands with someone. It was in the same vicinity for about 40 minutes. So there might be spread a little bit more common than we once thought before.
So again, what do we do to make sure we're safe?
Good hand washing, that's always the key.
Yeah, it is. You just do it all the time if you can, right? And well, another report from the journal Cancer Research says that 20 to 30% of pancreatic cancer will become the second, by 2030, it will become the second most prevalent cancer. That is very scary, and we don't have promising results when it comes to treating pancreatic cancer.
Exactly. And the reason it's going to become the most common cancer is twofold. One, the most common cancers, such as lung cancer, colon cancer, and breast cancer, we're recognizing them earlier, we're treating them earlier, so treatment for that has gotten better. The problem with pancreatic cancer, we don't really have a good screening test developed for it yet. There are some in the works, but right now we don't have great screening.
So what should we be paying attention to? Probably family history.
Family history does count to some degree. Age, the older you are, the more likely you are to have it. If you're obese or have type 2 diabetes, it puts you at increased risk. And if you start having symptoms like chronic abdominal pain, nausea, vomiting, and you start having unexplained weight loss, talk to your doctor because that could be signs of pancreatic cancer.
Okay, and is there anything we can possibly do to ward off that in the first place? Just general tips.
Basic things are just making sure that you keep your weight under control.
Which means that we need to sleep enough.
Exactly.
Going back to the first story today.
Sleep and exercise.
It really is underrated. Okay, thank you so very much.
Thank you for
Dr.
having me.
Krista Foster.